I now have the honor of introducing our commencement speaker, the 25th Secretary of Health and Human Services of the United States, Secretary Xavier Becerra. I invite you to read his bio in the program, but I'll just share this as he comes up to the podium. Secretary Becerra championed the Affordable Care Act as a member of the United States Congress. He defended the Affordable Care Act as California's Attorney General, and he implemented the Affordable Care Act as the Secretary of Health and Human Services. Please join me in welcoming a true change maker who has dedicated his life to the fight for health equity and social justice for all, Secretary Xavier Becerra.
It is good to be home from Washington, D.C. It is nice when you get to see a blue sky, and almost on cue, the baby started crying. And I was smart enough not to wear cardinal red to come to a UC Berkeley graduation commencement exercise. And so I will tell you that you are in the right place. We are in the right place because history is being made today, because the future starts here where you are with these graduates, your family members, your sons, your daughters, your pupils, the people who will change America and will change the world for the better. So thank you for allowing us to join these graduate students today here at UC Berkeley. Dane Liu, to you and the esteemed team at the UC Berkeley School of Public Health, thank you for considering me to join with all of you today. To the parents and families, I remember sitting there, the first in my family to get a university degree. I remember sitting there as the proud father, along with Dr. Carolina Reyes, my wife who is here with us today, watching as our daughters graduated. To all the parents and family members who are rejoicing out there, congratulations. One more proud moment and one less tuition payment. And of course, most importantly, the extraordinary graduates of the class of 2025. To each and every one of you, as we would say, salud, salud, which aptly means to your health. And here, if I may, I'd like to take a moment on behalf of Carolina, me, and I hope you as well, to send strength and prayers to my former boss, President Joe Biden, to his wife, Dr. Jill Biden, and their family, after the news of President Biden's cancer diagnosis. We wish you, boss, Godspeed, and thank you for letting me send him that message. Okay, so graduates, indulge me for just a moment, because I remember being where you are. Close your eyes, just close your eyes briefly, and take a moment to visualize, the people, the events that made your journey possible, the joys, the hardships, the doubts, the resilience. Okay, now open your eyes. You're here. It wasn't a dream or a nightmare. It's real. It is real. And you know what else? You know what else it is? It is game time. It is game time. For years, and I know your professors will tell you, your parents will say it, I heard it all the time. You've been saying, put me in the game, coach. Put me in the game. I'm ready. Give me the ball, coach. I can score. Well, we're putting you in the game. And it's real. You are the future of public health. The health of our families, our nation, our economy, of the world, literally. It all rests on your shoulders. No pressure, by the way, no pressure. Now, do me a favor. Look at your classmates, those around you. They are now not just your classmates, they are your teammates in the fight for universal quality public health. It's a small world, and you will cross paths more than you can imagine. And the world is guaranteed to throw one public health crisis after another your way. Believe me, I know. Just think, you get to go from pulling all-nighters studying public health to pulling all-nighters saving public health. Yeah, and that's not a joke. That's not a joke. I spent, as Dean Liu mentioned, years in Congress battling alongside many of my colleagues trying to pass the Affordable Care Act. In the wealthiest country in the world, the number of Americans without health insurance was approaching 60 million when we finally succeeded in 2010 to enact the Affordable Care Act. 10 years later, this time as the Attorney General of California, I had a chance, as Dean Liu mentioned, to defend the Affordable Care Act all the way to the Supreme Court, and we won. So when I came to be the Secretary of the Department of Health and Human Services in 2021, you can imagine how anxious I was for Coach Biden to put me in the game, Coach, put me in the game, to deploy the ACA, to fight for the millions of Americans who couldn't go to the doctor or take their child to the hospital without fearing that they'd lose their house or go into perpetual debt. By January 2025, after 4 years as Secretary crossing the country and reaching out to uninsured Americans everywhere, even in the middle of the worst pandemic any of us had ever experienced, more Americans signed up for health insurance coverage for their families than ever before. Today, more than 300 million Americans, never achieved in the history of this country under any other president, Americans have coverage for their family the way they've never had it and can go see that doctor. They can take their child to that doctor and not worry about losing their home or going into perpetual debt. That is progress. We need to score more of those touchdowns, and we can't afford to have the team currently on the field in Washington, D.C. fumble away our gains. And this is where you come in. Too many Americans still cannot access adequate care when they need it. Children are again needlessly dying of measles, a disease we work so hard to eradicate. Avian flu is hovering just around the corner. Not far away, Ebola still threatens. And it's as if viruses and bacteria and natural disasters like hurricanes, floods, and wildfires weren't enough, we also have to contend with man-made disasters. Why is the federal government halting medical research that helps fight cancer? Why did the federal government shut down CDC collection of injury prevention data that helps us tackle child abuse, drownings, and car crashes? Why is this administration slashing funds for Meals on Wheels for seniors in America? And why did they pull America out of our partnership with the World Health Organization at a time when the world needs more, not less collaboration to stop disease and death from spreading, including to our shores? We need you. Will you hurry up and grab that diploma, even though it's not the real deal? Your time at Berkeley has been shaped by an institution renowned for its legacy of social justice, its pioneering research, and its unwavering commitment to health equity. And you're not afraid to say those words. You have been challenged to think critically, to question assumptions, and to master the complexities of public health in a rapidly changing world. You have delved into the intricacies of health policy, epidemiology, environmental health, social and behavioral sciences, and biostatistics. Have you all figured that one out yet? I'm still trying to figure that one out. You have grappled with social determinants of health. You recognize that health is not merely the absence of disease, but a fundamental human right. One that is inextricably linked to social, economic, and environmental factors. The world you are entering faces unprecedented challenges. We may not get to choose the challenge that we face in our time, but we do get to choose how we meet it. In the U.S. today, Black and Indigenous women are 2 to 3 times more likely to die from pregnancy than white women. 9 out of 10 Americans believe that our country is experiencing a mental health crisis. Drug overdose deaths surpassed 110,000 in 1 year with the onset of the COVID pandemic. Extreme heat and the escalating climate crisis are leading to superstorms, major flooding, urban wildfires, and devastated communities. These challenges demand innovative solutions, collaborative action, and a deep commitment to social justice. Remember, you're not just inheriting these challenges, you're inheriting the opportunity to solve them. That was our mindset when I was secretary at HHS. For the women that I just spoke of, who anxiously face the pressures of motherhood with their new babies, we extended Medicaid postpartum care from just 60 days for the entire year to 365 days for the year. For Americans experiencing a drug overdose or mental health crisis, we launched 988. Think 911, but for those experiencing mental substance use crises. It's a nationwide 3-digit number that serves for those who are about to take the wrong fork in the road. We made Narcan, which you may know as naloxone, which can save and reverse death when it reverses an opioid drug overdose. We made Narcan available over the counter because it works and it saves lives. And I hope you've heard the news. Last year in 2024, drug overdose deaths dropped by 27%. 30,000 fewer sons and daughters who died senselessly here in America last year, the largest one-year decrease ever recorded on our watch. To further move our healthcare system from one that principally treats illness to one that promotes wellness, HHS has championed to become a partner in the Food is Medicine movement. I needn't say more. Food is the best medicine your children can take. Our work at HHS and our successes were not a matter of luck. They were not accidental, and they were not easy. They were intentional. We chose to meet the challenge. And you have chosen a path that is not always easy and often unseen, but it is undeniably vital. The well-being of communities, the pursuit of health equity, the prevention of suffering. That's your choice, and it speaks volumes of who you are. So be intentional. Remember the values that have guided you here. Equity. Strive that all have the opportunity to achieve their full health potential. Evidence. Ground your practice in rigorous science. Community. Engage, respect, and empower the people you serve. Action. As Master Yoda perhaps put it best to Luke Skywalker, try not. Do or do not. There is no try. And the value of resilience. Attack your work with ganas. Okay, don't look it up. Yeah. For those who know it, explain it, because if they look it up in the dictionary, it'll say desire. No, come on. Ganas is guts, grit, and game all rolled together in one. Ganas. Have the resilience. Have ganas. Amen. Sí se puede. Sí se pudo. What should I say? Graduates, you are stepping into a world that needs your passion, your integrity, your courage. As you stride forward and accept your diploma, carry with you the spirit of Berkeley. Lean forward. Lead with passion and compassion. Leave no one behind. Public health done right packs the power to improve lives, to transform societies. You are now officially part of this proud tradition. You are in the game. Now, it's up to you to wield your superpower. No pressure, just get it done. Thank you very much, and success to you all.